Tonight, an emerging health concern linking a local water crisis with a global pandemic. Good evening. Thank you for joining us. I'm Dustin Lukey. There may be another worry for those who live on French Island who don't know if the water from their tap is safe to drink. Now, experts are drawing a connection between per and polyfluoroalkyl substances, or PFAS, exposure and COVID-19 vaccine effectiveness. News 19's Marcus Harsvold tuned in to a DNR and Department of Health webinar today. And Marcus, we've covered water contamination extensively here locally, but PFAS exposure can come from other sources as well. As we've noted, what should people be on the lookout for?
Well, PFAS can be found in everyday items made to resist grease and water, like nonstick pans. During the webinar, they explained that the most common exposure to PFAS is through food. DHS says it's found in a lot of food wrappings, and that more people are exposed to low levels of PFAS than we might think. Plus, studies on the side effects are so new, it's hard for DHS to pinpoint exactly how it might be harmful. They say some who've been exposed to high PFAS levels experience increased cholesterol, decreased fertility, and less effective responses to vaccines. A big concern right now with the COVID-19 vaccination rollout.
So this doesn't necessarily mean reduce our ability to fight an infection, but when we get some sort of like a flu vaccine and then the doctors test for antibodies a little while later, people who are exposed to high levels of PFAS have been shown for certain types of vaccines to have a lower antibody response.
DHS says all they can do is continue to research and study people who've been extremely exposed. For our town of Campbell folks concerned with securing safe drinking water for the future, it all comes down to funding from Governor Tony Evers' biennial budget. Dustin, 35 contamination sites are listed on the DNR's website in the state of Wisconsin. DHS says right now his PFAS relief budget is just over $20 million. That money is intended to cover continued water testing, research, and provide safe drinking water.
Less than $1 million per site, and that could change, right, that amount?
Exactly. It still needs approval from the Joint Finance Committee, and the earliest that could happen is in June.
So still a long road ahead. Thanks, Marcus. And tonight at 10, we'll hear from Town of Campbell representatives who also tuned into the webinar, explaining some local action you can take to advocate for more money on those relief efforts.